Trichomonas vaginalis and its epidemiology. It is a protozoan parasite, causes trichomoniasis, sexually transmitted infection which was first discovered in 1836. Most common non-viral, curable sexually transmitted infection in the world. Affects 248 million people, mainly in low-resource settings. Approximately 3.7 million people have the infection in the United States, and only about 30% of the people have symptoms. The prevalence of T. vaginalis in the Philippines is increasing. Its life cycle. It is a single host, either male or female, transmitted sexually from a woman acting as a reservoir of infection to man. So the first thing in its life cycle, it resides in the female lower genital tract and the male urethra and prostate. Next is it replicates by binary fission. And last is the parasite does not appear to have a cyst form and does not survive well in the external environment. Trichomonas vaginalis is transmitted among humans. Its only known host primarily by sexual intercourse.
For morphologic forms, the Trichomonas vaginalis has oval to pear shape with a size of 10 to 20 microns. It only has a single nucleus but have four anterior flagella and an undulating membrane. As previously mentioned in life cycle, it exists only in trophozoite form throughout its life cycle. Hence, it doesn't have a cyst stage. To take it deeper, the main difference between the trophozoite and cysts is that the trophozoite is active, feeding, and motile stage of protozoa. Meanwhile, in the cyst stage, it is a dormant, resistant, and non-motile stage. The Trichomonas vaginalis only existing in trophozoite is one of the main reasons why it is more vulnerable to environmental conditions and requires direct transmission, typically through sexual contact. It colonizes vagina or urethra that leads to its inflammation, itching, and uncommon discharge. Of course, for human infections, it requires direct transmission via sexual contact, which is semen or cum and vaginal fluids. Trichomonas vaginalis causes trichomoniasis, and its signs and symptoms in humans include itching or irritation of the vulva and or vagina, the discharge that is green, gray, frothy, and or thin, with a foul or fishy smell, pain with sex, and pain or burning when peeing, or a frequent need to pee. And lastly is the spotting or bleeding between periods. Next, for laboratory diagnosis, trichomoniasis can be diagnosed through first physical exam. It can be examined the genitals and discuss any symptoms. That includes the pelvic exam for women. Strawberry cervix is an indication of TRICH. Next is the rapid antigen test, which is only done on samples of vaginal fluid to look for antigens from the parasites. Next is the nucleic acid amplification tests to look for genetic material from the parasites that cause trichomoniasis. And the last one is the culture tests, in which the sample is sent to a lab where the cells will grow up to a week and the sample will then be checked under a microscope. Lastly, for treatment, the trichomoniasis can be treated with metronidazole and tinidazole. Women should be prescribed metronidazole for 7 days, and a single dose of the same medication cures up to 95% of men. You and your sexual partner must get treated for TRICH, and you'll continue to pass the infection back and forth. Of course, you shouldn't have sex for 1 week after finishing the medication to give the drug the time to kill off the infection and for the symptoms to clear up. Of course, you should see your healthcare provider in 3 months to ensure that you don't have the infection anymore. And lastly, for prevention and control, trichomoniasis can be prevented through proper condom use, proper perineal care, having sex with one partner who has tested negative for STDs and only has sex with you. Concurrent treatment of sexual partners is recommended to prevent reinfection. And lastly is the routine STI screening, although you don't have symptoms with the trichomoniasis.
And here are the interesting facts about Trichomonas vaginalis. Trichomonas vaginalis is not an exclusive parasite of women. It also infects men. It affects about 5 million new patients every year in the United States. It's more common than gonorrhea, chlamydia, and syphilis combined. You may have trich and infect other people but still not know it. Up to 70% of infected people don't have symptoms. So, to conclude, the parasite is sexually transmitted and the infective form is the trophozoite, which reproduce through binary fission. Most infections are asymptomatic, making detection and control difficult. Up to 70% of the people don't have the symptoms and can infect others. Hence, routine STI screening is a must.
Get your routine STI screening now. Stay safe and curious.